Hey everyone, it's Red Sox Day, PAD Awareness Day, and we are getting ready for our live show on KDOW. I'm live in Virginia Beach with Dr. David Dexter, so stay tuned. We're going to talk about who should be on your vascular care team, so stay with us.
The Dragon's Prophecy combines history and scripture with faith, justice, and renewal. The Dragon's Prophecy, a new film by Dinesh D'Souza. Now available on Amazon, YouTube, and iTunes.
KDOW, Palo Alto. Business radio that goes where you go. With our mobile app, KDOW.biz. Tune in, iHeart, and the Odyssey app. AM 1220 KDOW.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation, 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhealth.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kym McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Hey everyone, welcome to an amazing show today. It's PAD Awareness Day, or should I say Red Sox Day for PAD awareness. Peripheral Artery Disease, meaning the poor circulation in mainly the legs. Leg health can indicate your risk for a heart attack, stroke, and even amputation. With me right here, we have Dr. David Dexter. He's a vascular surgeon, Sentara Health in Virginia Beach. I'm on location, Dr. John.
I know. I saw that. That's awesome.
Right here.
You're in a office-based cath lab, so I was hoping maybe we could do show and tell. That'd be kind of cool actually. Maybe show if we have some time, we can look at some of the equipment and whatnot and tell our guests. I bet you most people don't even know where we do these procedures. So something we could share here. It's awesome.
No, it's kind of cool. I mean, it's very simple. I mean, with all the products that are used, and I keep hearing this over and over again, and it makes me cringe. The roto-rooting cases. Whoever started that drives me crazy.
Yeah, I mean, first of all, thank you so much for having me today on this show. It's really great to be able to do this and talk to the community of everyone in healthcare for saving limbs. So couldn't be happier to be here. At the end of the day, the reason I think that people call it roto-rooting is that, as John and I know, we are glorified plumbers. I mean, our job is to replumb the pipes when you can't do it on your own through exercise and medical management means, is to find a way to get flow from point A to point B.
Yeah. We have quite a bit of, big studio audience that's actually here today. You can see we have some of our favorites.
It'd be great to get let them ask some questions. Yeah, it'll be fun.
Yeah, we love having the live in studio audience. If you ever want to be in the live in studio audience, make sure you do email us at info@padhelp.org. We'll get you in. You can also on our YouTube channel, youtube.com/the Way to My Heart. You can go there. We have our amazing producer there, Joshua, who is actually bringing us all the comments and questions that are from there as well.
So, Kym, I'm going to put you on the spot because you opened my eyes recently. We were texting yesterday, as it were. But so, sometimes folks will ask me like, well, you guys need to broaden your reach a little bit, and I'm like, yeah, I guess so. Kym does all the work. I'm the Troy Aikman to the Joe Buck here, as I've said. I'm here for color. But you kind of told me we have a pretty good streaming audience, better than I thought, and better than some of these other medical podcasts out there. Is that accurate, or were you just kind of
our KDOW, our stream in the San Francisco Bay Area? We love our listeners there, thanks to our producer there, Chris D. We have 107,000 streams per month on just 4 shows. That's live streams. That's not even counting the streams that occur after the show is no longer live, that it's just sitting there. In terms of our YouTube, we've gotten nearly 1,000 new subscribers in the past 28 days, more than 566,000 views. So we're really rocking it, and it's really amazing. I was just talking to Dr. Dexter about how this is really the time for PAD, and it goes through cycles. And you were saying the last time that we heard a lot about PAD was what, maybe
20
years ago.
I mean, innovation has a life cycle, and to get a new drug to market, to get a new stent to market, a new balloon to market that's truly transformational and truly different takes a lot of time. And we are seeing so many more doors opened in the last 2, 3, 4 years with different medication therapies that we can deliver through interventional means down to the lower leg to try to do things that we just couldn't do 5, 10 years ago.
Yeah.
So it really is a very exciting time to do this work, to really try to help people.
Yeah. You see that a lot, right, Dr. Phillips?
Yeah. I mean, well, number one, when you look at in the next 4 or 5 years, by 2030, I think I've said this before, but 20% of people are going to be over the age of 65. And I think of that, like the fastest growing subset of the population is 80 plus years old folks. And so, yeah, we're living longer. I just saw that the life expectancy kicked up a little bit here for us, so close to 80, which is nice. But yeah, folks are living longer, and unfortunately, diabetes is going to still be prevalent, which is why we do what we do here, to try to raise awareness and be more proactive than reactive. But I think folks are going to need work in CLI. So the major issue with PAD, the limb-threatening portion of it, is not going away. And as David was saying, like it's been a while since we've had some new technologies out there, particularly to help with blockages below the knees. So it's a pretty exciting time. It's a good time to do what we do and help folks, and obviously be a part of the show.
I tell all the patients that come our way that if you're going to have PAD, now is the time to have PAD, because innovation is moving at the speed of light. Whereas, let's say when I first started Global PAD Association 6 years ago, more than 70% of our patients were misdiagnosed something other than PAD, with textbook symptoms of leg pain, leg cramps, neuropathy, whatever it might be. They were told it's diabetes. They were told it's back issues. They were told arthritis, fibromyalgia, everything else. And now we're seeing more and more patients with their gatekeepers actually getting diagnosed sooner with PAD. And it's all due to the awareness campaigns that are out there.
I think we should really stop and talk about why it's Red Sock Day, right? I mean, it's Red Sock Day because you're supposed to bring attention, bright red attention, to your feet. I told you a story before we started the podcast today that I was examining feet before spine exposure in my office, because as I'm manipulating the contents of the belly, I'm going to see your major arteries. And if I change something, I have to know the difference. And that patient told me, who's diabetic, that she hadn't had her feet examined in the doctor's office in the last couple of years. And that's part of what this awareness is, right? It's save my piggies, show me your feet, show me your socks. And patients should be asking for that in the doctor's office.
And we even have the socks that say at the bottom, "Hey, doc." I said, "Doc, not dog. Hey, doc, take off my socks. Check my feet. Check my pulses. Feel the temperature of my feet."
Yeah, I ordered a couple pairs. I hope they show up pretty soon. And we'll, I try to give my patients a pair of the Save My Piggy socks that we had a while back, and folks like that. And the other thing, real quick, I've noticed a couple people have sent me pictures of, folks that have lost a toe or two, and then they'll get tattooed, where the amputation site is, like 2 little feet, and it says RIP, and then it says the day, from whatever year they were born to the year that the toes were amputated. I've seen that twice now, so I don't know if that's a new trend, but I guess it's a kind of a clever way, and maybe just a little bit more in the spirit of things, like way of looking at, okay, I lost my toes, but it didn't take me. So I thought that was pretty interesting.
Have you seen these crazy tattoos?
We do see some crazy tattoos. I have never seen a toe stone rather than a tombstone, but on the lookout for it now, John.
All right, man. That's good stuff.
Yeah.
On that note, this is a totally amazing show for PAD Awareness Day. Stay with us right here on KDOW on the Heart of Innovation. Coming up next, Josh.
Here we go.
It's like, we're through to break.
I do have an interesting quote from a vascular surgeon that I think is salient. So if possible, I'd love to share it in our moment of inspiration.
Hey, Christy, Can we go straight into spectacular vascular?
Sure.
Thank you.
What's the weather in San Diego or San Francisco, Chris?
It's all right.
It was raining right before I left. It was completely storming and flooding, and it was a mess.
Yep.
We almost couldn't take off. Yeah. It got pretty bad. And then suddenly this.
Does Dad live in San Fran?
Mm-hmm.
So you guys medically transferred to North Carolina for his procedure?
We just flew normal.
Yeah, but he came here for this.
Yeah.
You couldn't find somebody good in that area?
I wanted him to go pedal. I didn't want to go to the groin. And this guy, Sid Rao, has done so many of these procedures, and he's written papers on it. And he did his hands. He did the hand osteoarthritis for him.
Okay, perfect.
And so he trusts him.
Did it work?
The hand one? Oh, yeah. He could actually bend his fingers now.
Interesting.
As I said, I think that he could have done without
30 seconds.
having the knees right now, because then next week he's having carpal tunnel surgery. But you know, my dad, he wants to be able to run with the big boys. His 40-year-old neighbor, he wants to be able to go 4 miles and walk those hills.
Is getting older looks like an American, right? It's people have illnesses and they want to be normal until they're dead.
Yep.
So we are now able to do things where we can.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips, spectacular vascular moment of inspiration.
I can see John's not even reacting anymore to that. It's always fun when I have another doctor here.
I know.
Let's to hear that.
When I meet you in person, John, I'm going to start with that.
in my head, like that is what 4 years old. However long we've been doing 3 years old. How long we've been doing this, and I'm always smiling, whether or not visibly, but in my head, I'm smiling. And
it was a joke to him. You know, he always had some sort of moment of inspiration. And Mikey, who works at KDOW, and I got together and we're like, you know what? He needs a moment. He needs a moment of inspiration. And so he put that together for Dr. John.
His patients, when he walks into the cath lab, they want to see his red cape getting hung on the hook as he's walking in. I mean, that is how people see you, and you should know that.
Yeah. It's interesting because when I like quotes. I like to start talks with quotes and whatever. So that's kind of how this evolved. And anyway, so today's quote is from a famous vascular surgeon, René Lariche, back in the late 1800s. He died in 1955, and David knows more about him than I do. But there's a syndrome that he coined. Lariche syndrome, where folks have blockage of the aorta and into the legs. But at any rate, I was looking for a quote about humility and just kind of learning from complications, because we had a complication this past week that you have to learn from these things, because we always talk to patients about the risks and the benefits, and low risk usually, but if it happens to you, it either happens, so it's 100%, or doesn't. But nonetheless, and so I thought this was kind of curious and thought-provoking. So Lariche is quoted as saying, every surgeon carries within himself a small cemetery where from time to time he goes to pray, a place of bitterness and regret where he must look for an explanation for his failures. And I think and I'll let you speak to it, Kym, and then David, if you'd like. But for me, it talks about the humility of it and learning from our complications and kind of the ethics of what we do. Because at the end of the day, we are trying to help people, and we play with dangerous tools, and sometimes things go sideways. But if we're not reflective and looking at how we could get better, then we're not moving forward at all.
Yeah, I mean, we always have to learn from our mistakes. We're not perfect. What we do is really hard in PAD, from the advocacy side to the practical side, where you're actually trying to save limbs. And every single day, the thing is with the arterial landscape, and you both know, is there's never the same case. Everyone's arterial flow seems to be a little bit different. There are always these anomalies. You might have someone that's had a knee replacement, or things like that. And so it's always a new day. And I tell the patients, that's why the most durable procedure, the only safe procedure, is walking. You've got to do that first. Do not jump into having a roto-rooting procedure with a plumber until you try that first, because there are these complications. We had a patient just 2 weeks ago that ended up with compartment syndrome. And if I wasn't on the phone with that mother, the doctor was going to lead by upping just the morphine for that patient. And I kept saying to the mother, compartment syndrome, get them to check. And lo and behold, compartment syndrome. And they had to rush her down and slid her down the leg and get some relief.
I still find that hard to believe, but
I know. Well, I just couldn't believe that they didn't check. He felt the foot and he said, you have a pulse, you have a warm foot. And he didn't bother to remove the blanket from the leg until she said compartment syndrome. But these complications do happen, and it's a risk with every procedure.
100%.
So I feel staged right now. I've not talked to John about this quote before he gave it a few seconds ago. From my world standpoint, this couldn't be more timely. Yesterday is our once a year annual symposium for vascular surgery, where we bring in a world famous guest to talk about the impact of vascular disease in the local community. We've been doing vascular surgery before it was a field independently here in the Hampton Roads area of Virginia. So John Eitz, who is a world famous vascular surgeon in Dallas, Texas, came and gave us a talk about exactly that topic.
Wow.
My entire department, with the whole Department of General Surgery, must have been 600 medical students, residents, and faculty, heard about what it means to absorb a complication, what it means to you as a physician, how it impacts the patient, how it impacts the family. I think to your listeners, I think what's really important for them to know is that what John just said is true. When we go and intervene upon somebody, I did just make a joke that John puts his red cape down and plays Superman, but at the end of the day, there's a lot of humanity to this. Yeah. And when things go wrong, you don't suffer alone as a patient or as patient's family. Your doctor and the team with that doctor in the room, we suffer together. And this is about saving legs. When somebody loses a toe or loses a leg, you're not losing your leg. We are losing your leg as a combined entity. Yeah. We just spent yesterday and Thursday night prepping for exactly that. So love the quote, know the quote, love what Larish added to our world, as you know. I mean,
yeah.
So
no, it's difficult. You straddle the world of kind of chaos and control, like the yin and the yang of it. And there are some physicians that I have noticed as they get older, they kind of detach themselves from some of these issues. But I feel like for me, emotionally it's taxing, but I think you become a better person and physician if you still remain engaged with that person and remember that, they're a father, a son, a brother, an uncle, whatever. And it's not just a artery in a leg and then, move on to the next one, assembly lines, etc. So great, Dave.
And Douglas,
great. Yeah.
Douglas actually has a very timely question in our in-studio audience. He's the head of our PAD Warrior Task Force. Douglas, what's your question?
Yes, ma'am. Listening to that quote, Dr. John, I was thinking, how much pressure as a patient do I put on my doctor to be perfect every time I see him, to be on top of his game 100% every time? That's got to be a lot of pressure.
Yeah, I'll share my thoughts with that, and interested to hear what David's thoughts are. But you kind of have to be on your A game all the time, and not everybody's on their A game all the time. And I'll sometimes draw inspiration from an athlete. For a while there, it was kind of like all right, Tiger Woods, I mean, like he's going out on Sunday in his red to win the Masters or whatever, and he's got to play 18 pretty good holes. He's going to make some mistakes, but hopefully he's going to hold it together. And that's kind of how I approach these things. Yes. I also approach it in the sense that if I, you talk about, we were just before the show, we were talking about we're there in Virginia Beach, so a lot of Navy SEALs. So you got like tier 1 military specialists, and a lot of those guys and girls will tell you, like, they just take one step at a time. Like, all right, what do I have to do to get to point B? Now, how do I get to point C? And then all of a sudden you connect the dots. And that's kind of how I approach it. Because if you do, at least for me, if I start thinking about like you as, what you're going through and your family and stuff, you can get, you put your toe in that water and you can get sucked out into a riptide really quickly, and it'll throw you off your game, or at least will for me.
And coming up next right here on the Heart of Innovation, I want to hear from Dr. David Dexter and how you prepare for the game each day. So stay with us right here on the Heart of Innovation on KDOW. Don't go away. That's fun.
Yeah, it is. Did you guys start doing it together a couple of years back?
Yeah. John, when did you start this? This was like, we have to be in
2022, I think.
I think it was 2020, yeah.
Because we did our first couple of shows. I mean,
in May of
for some of them, David, like I was driving in the car, and we've evolved. Well, Kym's evolved and just pulled me along, like kicking and screaming sometimes. But like, and it goes. She puts so much work into these things that it's a lot. There's a lot going on, but we've been doing this a while, and we've got pretty good following and good support. Now, can I ask you guys this? Now, the camera that you have, is that movable or no?
Well, here's what we'll do. In one of these sessions, I've got a table next to me. On a break, I'll pull a couple of everything.
Yeah, I mean, I would love, that'd be sweet if you could just show folks what it is we're looking at there.
Which session do you want to do that on? You want to do it?
This one's too short. This one's short. So this one we should do. In Dr. Phillips, if you want to toss to him, asking him, because I'd be interested to hear your pre-game, get your head in the game, because everyone is personal. You have personal things going on. How do you prepare? Also, how do you prepare? If you have a bad case, you have to go into the next case and reset your mind. How do you do that?
Yeah, happy to. But in between the next two sessions, I'll stack some balloons, stents, end deflators, things. I'll get the IVUS a little closer, if the matherectomy is a little closer. Yeah. And then
and then just share with if you can, like what it is they're looking at. That's
of course.
Yeah, I can actually take it's a pretty good size cord. So I'll turn this to me and I can turn the camera towards you. I can take the camera off.
And Dean's rubbing it in. It's 70 and sunny.
In San Diego.
In Carlsbad. So
it's not okay.
That's not okay.
I think Dean, on for this.
Do you really relish that and cherish it because it's always that way? Like,
no, it's 127 in the summer for him though. So
yes, you got to take the good with the bad.
Is it ever nice in Columbus though?
It honestly is. Like I'm from Wisconsin, so the weather up there is much worse from a cold standpoint. Here, this is surprising. We got a lot of snow, and it just finally melted. But most people feel like we're maybe done with snow. I don't know. Although I guess it's supposed to snow a little tomorrow. Who knows? I don't mind the snow. I need to get south as soon as I can.
I'm hiring in Virginia.
Us ICs are kind of a dying breed, I think. So I don't know if you probably don't need me.
You can do a coronary or two.
Yeah, I'm a plumber as a
30 seconds.
Plumbing.
You just had a great coronary case, actually miracle case. During one of the breaks, you should share it with him. That was just a crazy case.
That reminds me. Shoot, I need to call that patient. Thank you.
Yeah, I want that patient. Great coronary case
on a number of levels.
During one of the breaks, you should share it with him. That was just a crazy case.
That reminds me. Shoot, I need to call that patient. Thank you.
Yeah, I want that patient. Coronary case.
Yeah, hey, John.
Was that me?
I don't know.
1220 KDOW.
Yeah, hey, John.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Hey, everybody. We're having a grand old time today, and I think we're kind of doubling as weather people because it's cold in Columbus, and it seems like it's okay in Virginia Beach. I've been told it's sunny in Carlsbad. No, but getting back to the show, happy to be joined by Dr. David Dexter, vascular surgeon out in Virginia Beach. So, David, how do you get your game face on when you're preparing for a case when there's a lot of chaos often in the midst there?
Yeah, I think you said it really well when you started out with a sports analogy, and then you brought it to a military analogy. I think the surgical mentality is very similar from a type A perspective. I think the people who choose to go into a surgical or a procedural based specialty or medicine in general are very similar to professional athletes or to our military. We are programmed to win. I mean, it's a very unique personality to go into an operating theater, a cath lab, an interventional radiology suite, and take somebody in a vulnerable part of their life and say, I'm going to do something to you. So to answer Douglas correctly, there's no amount of pressure you can put on me that I'm not already putting on myself. So I think what really helps me is that I know I'm not there alone. And I think that probably is from the Navy SEAL training in town. I've got a lot of SEAL friends in my neighborhood that I live and see every day. They'll tell you the same thing. This is not a one-man mission, right? I'm in this OR, in this cath lab that we'll give you a tour of in a few minutes. I've got a nurse by your left shoulder. I've got a tech scrubbed with me, and I got a tech circulating the room, getting me things I need. I've got 2 nurses out in pre-op that have done a million things to you before we start. There'll be 2 different nurses in post-op. And then at the end of the day, we're debriefing with our management team to make sure we have the things we need for tomorrow. So, I mean, this is day in, day out of what we do. We have a great team in every cath lab, every OR across the country. That's what makes us really great at this. In terms of the other part of the question, what do you do when something goes wrong? When you go to the clinic and you see a patient, or you're a patient waiting for the doctor to come in, some days your visit's 3 minutes because you don't need the doctor. You're there for surveillance. You're there for an ultrasound. You're there to get seen. We look at some feet. We talk about your family and you go. Some days you're there for 27 minutes. Some days something's wrong and you get the time you really, really need. My patients love that. They know that if their visit's long, somebody else is being shortened, but they know that we're hearing them, listening to them, spending time with them. And they know if they don't need me, hey, man, I want to go to lunch too. I'll see you in a couple of weeks for my next visit. I'm like, great. If you need me, call me. You got my phone number.
Actually, that's a really good way to describe it for the people that everyone wants more time with their doctors. But I like the idea of, hey, doc, we don't need to spend a lot of time. We're good. We're good. Going to lunch. Hey, 3 minutes and out. And I think that's a good way to look at it. I mean,
yeah,
most
100%. Yeah, I mean, I love
about the lack of time.
I love and David, I love like you said, you're not alone, and you take it a step further too. At least in our practice, because I do all my procedures in the hospital. We're working on an OBLASC, but there's always another set of eyes to help you out. And if things go sideways, I mean, we like in STEMIs, when someone's having a heart attack and they're going things aren't going well. There's always folks to help with mechanical circulatory support and whatnot. So yeah, I mean, I think but at the end of the day, at least for me, if you really start, there's the paralysis by analysis. And if you start really thinking about what you're doing too much, you will get paralyzed. So it's like, they say self-control is strength and calmness is power. And that's how I try to approach these complications.
And just as these, vascular doctors have their entire team surrounding them, who should be on a patient's vascular team, not just the vascular surgeon, not just, in your case, Dr. John, the IC, who should be on a PAD patient's care team?
David, go ahead.
Yeah. So I think it starts at home, right? I think that it starts with the patient individually recognizing things and their own individual support system, right? That is on their team. There's this amazing online question right now from a patient who's actively listening. And it says, I walk every day. My question is, if I get sick or injured and may not be able to walk, will my PAD get worse? and how long until it reaches ischemia, right? So this patient is completely involved in her own healthcare. I think it was her.
Yep.
Which is amazing. And her family is too, right? So John, you and I can answer that question for her in a second. But when she goes in and starts seeing who her doctors are, who her specialists are, they all are part of her care team, because PAD is not a one organ thing. These patients with PAD have atherosclerosis, arterial disease, blockages in other organs beyond their legs, whether it's their kidneys causing early kidney failure, whether it's their heart, as a cardiologist, leading to coronary disease in their carotids. It can be anywhere. So having a cardiologist or a nephrologist, if you need to, they are your PAD team. And then if you have a disease that caused your PAD, that's why having a diabetic patient, having somebody specialize in their diabetes is so important. And then it's what are the ramifications of PAD? As Kym knows, we have a great rehab team here doing vascular rehabilitation. Our walking program can be individualized, where patients go and they walk on their own, or we can send them into our rehab structure where they get walked on a treadmill with a therapist with documented goals. I mean, your PAD team is as big as we need it to be to specialize your care to find the right things for people.
And that's why he was named our multidisciplinary leader of the year for 2025-26, which we never got to do the interview about, but
there you go.
Congratulations to him. And you can see why. I mean, it's pretty incredible, the robust system, the care team that you have.
We've got 30 seconds left, but it takes a village. I mean, it really does. And the biggest thing is finding out like who's the quarterback of the care, right? Like who's the person that is managing it? And like for us, it's often our podiatrist or wound care team. But coming up, we've got to go to break. But after break, these guys are going to give us a tour of the cath lab, so you don't want to miss it. Stay tuned.
Oh no, I'm not going to do
Joshua, how was that? How was that, Joshua? So that was okay. I'm not a pro like Kym, but I do my best.
You did great.
Most excellent. All right, so
I can I can't move further than this.
Okay.
I can.
You guys can start by just showing us the big equipment, the bed, and the image intensifier, all that cool stuff.
Yeah.
There you go.
And what I'll probably do is I'll end up spotlighting it like this. So everyone.
My background blur? Kym's. Well, there you go. Oh, is her background blur on?
No, it's not. It's just this. I got this new camera here. Autofocus. Do I want auto white balance contrast? Is it the focus? I just need to not have it autofocus. That's blurred. It's.
How much time can I expect, John?
I think it's 9 minutes.
We've got 7:40, so plenty of time.
It doesn't let me.
So what does it just focus on an object and then blur everything else?
It'll.
I'm going to bring everything within, sitting distance.
But I mean, you can pretty much see.
Dean says, "Show the C arm."
Yeah, there's a C arm.
Yeah.
I don't know why it's blurring.
It's because I'm probably still in field. If you and I get out, it should focus on the right. Yeah.
It's still blurring the C arm.
It's bizarre. Like it picks up something high res in the C arm and then it blurs the rest of
everything else.
Oh.
Let's bring this table forward. That's it. So good.
You see it?
Mm-hmm.
It blurs.
When you build your OBL, John, make them put fixed imaging in. Don't let them put a C-arm in for you.
I was going to say, that we are going to get fixed imaging.
I mean, we own this. We paid for this ourselves. It's straight off the top, and it is worth every nickel of the cost to make sure we have, what we need.
So weird. Oh, you know where I'm wondering if it is.
And it looks like you guys do the right thing too. You
just
got all the equipment. It drives me nuts when I see these OBLs that.
Oh, John, I've got a spree below the knee drug-eluting PLL extension.
Yeah, I mean, they cut corners.
Yeah. Well, here's the thing. I don't have any competition. So if I screw this up, it's coming back to me. It's not like I can do this as the pop-up shop.
Oh, that looks better. What'd you do there?
I just turned off the Zoom settings. Zoom was screwing it up, not my camera.
Yeah. Okay.
So now we know this is literally just came in the mail. So
perfect.
Is this a camera or phone?
It's an actual. I'd show you, but I can't.
Yeah, that's true.
So
it's a multifocal camera. It's pretty cool.
What I'm going to do, I'll remove the spotlight. John, you say hello. You're going to throw just to.
Yep, I'm going to throw to
Dr.
you guys.
Dexter, I'm going to be your camera person, so I can't say anything.
Okay. Oh, that's going to be tough. That's going to be tough.
You know me. I do not mind. I'm a great camera person.
Well, didn't you? I mean, I've when you were on in the field, right, doing news. It was just you and a camera person, right? Or sometimes
30 seconds.
I even preferred to do it myself.
Did you really? You set it up?
Well, I mean, I'm kind of high demand, so I wanted 5 cameras and I only had 1 camera person, and so I would be on camera. And
Joshua says, "Lock elbows, Kym. Stabilize camera."
He's such a smart ass.
He is.
Or he's giving you good advice.
Manufacturers and reduce the trade gap.
That's true too.
This is SR
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Okay, so this is a first for us. We are going to show you guys, so those of you that aren't YouTube or I guess on YouTube, right, Kym, that we're gonna look at the cath lab here, Dr. Dexter's cath lab. So let's see here. There it is. Okay. So David, a lot of people have never seen this. I mean, we talk about what a quote cath lab is, and it's the area of the hospital or an office where we do the procedures, right? So there's fluoroscopy and there's all the other ancillary equipment, the balloon stents. So walk us through what your state-of-the-art cath lab, the equipment there, what it all entails.
Yeah, Kym and I'll give you a tour here. If you see something in frame you want me to talk about, you just
what's that big thing that looks like a C? Yeah, what's that thing?
Let's start with the table, right? So in the center of the room, we focus on a giant table that have the ability to move, flex, bend, and do what we need it to do. And then up here, the patient's head, this is what fixed imaging looks like. So this is an X-ray machine that is bolted to the floor permanently. And we will bring this over the patient to the area of interest that we want to look. Your entire staff, when you walk into the room as a patient, is gowned up in not just sterile stuff, but also in centimeter thick lead. So that's a very common thing. I actually left my lead out front today, but this thing will generate X-ray out of the bottom, go through your body, give us images of what we're trying to look at, and then get received up top. It'll digitally get processed to that bank of monitors here or to a big screen based on what we're looking at. To start the procedure, I think all of us, John, use something like an ultrasound to get really good images. So we put a portable ultrasound machine on the far side of the bed, take a probe, look directly at their groin, at their wrist, at their elbow, based on where we're going to access. And that's what gets us inside the patient's body.
Okay.
Famous quote, all roads lead to Rome. Every artery that we stick will eventually bring us somewhere else. So if we're doing a limb salvage case, you can do it from the wrist. You can do it from the elbow. You can do it from the groin. You can do it from the foot. Depends on what that patient's anatomy is. Sorry, John, go ahead.
No, I was just going to say, because a lot of folks, you're demystifying what it is that we do. in the grand scheme of things, relatively simple. We're plumbers and we need to see what we're looking at, and we need to get into the artery or vein, and we need a wire to, or in your case, we need a scalpel and need to do a bypass of some sort. So now tell us what's behind you there. It looks like you've got a bunch of boxes on that table.
Yeah, absolutely. I sort of brought a bunch of things over because behind Kym and I are shelves that are just stocked with a million different balloons, wires, and stents and things. But
see all that.
Thought it'd be interesting to bring a few different things in.
Okay.
So at the simplest perspective, we have balloons. So once you get across a blockage with a wire, you have to have a plan on what you're going to do with the things that are plugged. So this is a 2 millimeter balloon here that's meant to go down into the calf level blood vessels. And this is a 3 that I grabbed as well. And they start at this smaller size, and they can go all the way up to 12, 14, 20 millimeters, depending on what size blood vessels we're interested in opening. And that's sort of the basis technology just to make space. The next thing that we have is one of these balloons that can have a drug embedded onto it. And that drug will go into the plaque or go into the artery wall and hopefully tell the body, let's try not to rebuild disease in this specific location. In some cases, that's good enough. In cases, that's not good enough. So I think that the next thought is something like a stent. So people always say, what is a stent? So a stent is a metal frame or a metal tube, and this opens up inside a blood vessel. So you take a balloon, you move things out of the way, and then you can deploy the stent. The one that I grabbed off the shelf was 6 millimeters in diameter and 30 millimeters or 3 centimeters long. It's a pretty short stent. It's indicated to go into the leg, either the pelvis or the thigh. And this is a permanent implant. And this is meant to permanently keep plaque on the outside of the stent, but still inside the patient's blood vessel.
Is it true that stents were originally indicated for biliary duct cancer?
So every stent was always trialed to get it into humans. So some stents were originally trialed for the heart, and almost every leg stent that we use that expands on its own with a memory metal was actually first trialed, yes, in the liver to open up the ducts that drain the liver into the intestines. Because the original metals we had were very rigid, very firm, like all the metals most people know, and you would put them on a balloon and bring them to size. And that's called a balloon expanded stent. That stent I just showed you, you're right, was actually a former biliary stent, and it's made of a combination of nickel and titanium.
Okay.
And depending on the temperature it's at, it can be put into a different size and it'll stay there. So it is set to go to that diameter at human temperature, 98.6 degrees, it will get or try to get constantly to that. So we talk about radial force of stents, which is the constant stretch until it gets to 6 millimeters. That's spot on. These boxes here are really interesting. This is truly a rotor-rooter device. This is a diamond-capped piece of metal that revolves thousands of times per minute around a central wire to make space inside a blood vessel. This device itself is tiny. It's just barely over a millimeter, and it can make a multiple millimeter core channel through a really hard plaque-filled artery. So for diabetic patients with a lot of calcium in their blood vessel, something like this may be used to preform a channel. Some of our devices really do look like rotor-rooters, and they actually have almost a rotor-rooter-like name. This is called Rotor-Rex, and this is also a revolving device that has a blade on it, and it's meant to cut through soft plaque, and it'll actually pull plaque and clot out through a tube system. So some patients have some clot in their legs on top of the plaque, and a device like this can be used to actually extract material from the inside.
David, we've got about a minute left, and I think in the next segment we can continue chatting about this. Is cool. So what else we got there?
So no doctor's office is complete without talking about laser beams. Laser beams sound like a really fancy term. They can do a lot of different things, but some can be used to vaporize plaque inside the artery. Over there in the corner, Kym is going to show them that giant white piece of equipment in the corner is actually a laser generator. And it plugs into a little tiny laser fiber like what I have in my hands right now. And that can be passed through the artery to try to make a change.
And coming up right after the break, we are going to continue the show and tell in Dr. Dexter's Cath Lab with Miss Kimberly as our camera woman. So stay tuned. You don't want to miss it.
I'm shocked you guys have never done products like this.
We've done a couple live cases actually, which would be fun to do with you at some point. We strategically did them we have a couple conferences usually each year, and whoops. Where'd we go? There we are. And so, yeah, we've done a couple live cases. We've also done a couple live to tape cases where then we edited in a few things, but would be fun to do one with you.
Sure, happy to.
And even if it's just live to tape and we do it pretty simply.
Yep.
Do you have one of those?
Well, is this our final segment? Oh man. Yeah, it is.
I know.
Shoot.
I know. I can always edit more in if you want it afterwards.
Yeah, we can. Yeah. I guess we'll.
But
how do you want to close?
Goodness. Well, I can let you guys finish out if you want. You only have 4 minutes. And so there are a couple more things. He also did a couple reflow cases.
Oh yeah, we better show the spur if possible.
I don't have the spur here.
Okay. We can talk about it. Some of the newer, why don't we wrap up with maybe some of the new-ish.
Yep. So in my hands is an
absorbable, yeah.
Yep. So that's fine. I have a Stellarex balloon in my hand. And we can talk about reflow.
Sure.
And can we quickly, because I know we have Jacqueline on there. Did you want to answer Jacqueline's question that she had?
Sure.
About John, did you see it?
Oh, sorry. My camera went off. Sorry.
Yeah, I was going to go back to you and then I realized that you weren't.
Let me see. What was the question, Jacqueline's?
It was about walking to ischemia.
Yeah, she take a 4-day break from walking because she's sick and yeah,
you'll be okay.
I think the answer to her needs to be, though, there are behaviors that will make your PAD worse.
Mm-hmm.
Taking a break from exercise is totally fine, but
it's one of the things, we always tell patients that when you are sick, there are a few things that you can do that are all clinically proven. They're all evidence-based. It's just not for PAD, but we do toe yoga. We tell them and we teach them how to do toe yoga. We teach them how to push the accelerator button, pull it back. We call it the pad 100. And you push it forward, you pull it back, you push it forward, pull it back. We also just talk about standing on your, while you're brushing your teeth and up on your tippy toes, down, up on your tippy toes, down. So little things like that that you can do while you're still sick.
You guys should partner with one of the lymphedema companies. There's now CMS approval for pumps for PAD again.
Pumps.
Oh yeah, yeah.
John, I don't know if you're old enough.
Like BioTab.
Yep. Remember the old days of having pumping units? We had one in Maryland where people would go in and get their legs pumped as part of their PAD.
Yes. Well, yeah, because but it's interesting. Oh, we got 30 seconds. Okay.
Later.
Oh, yeah, later. Lots to chat about.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Okay, kids, we've got about 4 minutes left. David, a couple other things you wanted to show us before we wrap up here? Some new technologies maybe for the particularly below the knee?
Happy to. But first, let's answer Jacqueline's question directly because I'm realizing now that you and I talked around it, but not directly. So, Jacqueline, walking is really, really important to help rebuild those new channels around your legs. If you get sick and can't physically walk for a couple of days, that is not a setback. That is completely okay. Just make sure when you get healthier, you kind of get back on your daily process to do things. As Kym reminded me, there's all sorts of other exercises you can do while you might be too sick to go out and walk a couple miles. And anything you can do to stay mobile, stay moving while you're sick will certainly continue to help. So I guess you're right. Let's talk about some new technologies, John. So a couple times I've referred to drug. Drug means something we can give into a patient to keep their plaque from coming back. So some things are called drug-coated balloons. This is actually paclitaxel. Paclitaxel was a drug developed for breast cancer to stop the cycle of cells growing. So after we treat your arteries, your body goes through this process by which you might create some inflammation, some irritation around your legs, and doing something to slow that down, stop that can be really important. So the paclitaxel-coated drugs are real. Sirolimus or limus-like drugs are also very, very real, commonly used in legs and in the heart. One of the newest stents we see, and if you don't want to leave a permanent implant behind, this is a bioabsorbable stent. So this is what we call a scaffold. This has a drug built in, similar to the balloon I just showed you, and this scaffold will dissolve over the course of time. So that keeps you from having a permanent implant in place, doesn't hurt somebody like me from doing a bypass to an area that I would have metal somewhere else. So really getting into some state-of-the-art stuff now in 2026, which has been great.
Yeah, and that was the Abbott Esprit.
Yep.
For those listening on the radio.
Absolutely.
And then we would be remiss if we did not mention our sponsor, Reflow Medical, with the Spur device. You want to talk about that real quick? We've got about 2 minutes left.
I would love to, and I'm going to say some things on the radio that maybe I shouldn't say because it tells you how good or how far Reflow is going with this. The Reflow trial, which I was part of, was a temporary stent. So you put this metal device with spikes into it, into the blood vessel, you expand it with a balloon, and it penetrates the wall. And what that does is it allows us to sort of expand the artery with maybe a little bit less pressure, maybe fracture the plaque up to so the artery remains flexible, and then we deflate the balloon, deflate the stent, and out it comes. It's shown really good rates of keeping vessels open. But the best part about it is it then allows us to deliver a drug further into the arterial tissue. And at some point coming to a cath lab near you and I, John, is going to be Reflow offering a research trial with the drug built into their stents.
Yeah.
So it's not just a system that helps us change the compliance or the flexibility of the artery, but will ultimately let us put the drug straight into the part of the vessel where we need it.
Yeah, excellent. And we've got 30 seconds left. And Kym, close us out because we're coming full circle here. We're talking about how no one wants to have PAD, but now's a good time to have it because we've got all this new technology. So appreciate everybody being with us. Kym, you want to say any closing words? Send us out.
Yeah, if you have any more questions about PAD and you have trouble walking, make sure you call our Leg Saver hotline, 1-833-PAD-LEGS.
Thanks, everybody, for joining us. Have a great
You've
weekend.
Been listening to The Heart of It.
Well, that was fun.
That was great. That was awesome. We had, you know what? I always say when we do procedures, there's a lot of mouths to feed with a lot of industry stuff. So you hit the gamut there. Good work, David.
Really purposely pulled different brands, different everything.
Yep. We are agnostic. We are agnostic.
We're a big system. We do just let you guys do this. So I'm not going to hurt you in any way, shape, or form.
Nope.
Agnostic.
And I don't know if we're still live on YouTube or not, or if we're out, or what we are doing here. So we are still live on YouTube. So hi everyone. This is the after show.
What's the YouTube caller? Yes. YouTube.com/ at the weight of my heart, right?
At the weight of my heart. Yeah. So when you join via YouTube, you get to actually see the behind the scenes. So all of you, we are live on KDOW radio in the San Francisco Bay Area, the #1 healthcare innovation show in the Bay Area, which is amazing. #1 women in innovation podcast in the nation. We still don't have a wig for you, Dr. John.
Exactly.
I still think that stems from my Kym McNicholas on Innovation, the general show I did before, where it just kind of combined. So, which is funny. But we do have a couple questions from our in-studio audience as Dr. Dexter is closing up over here, getting the cath lab ready for more cases next week.
There's one from Douglas. Douglas, what is your question for us?
Yeah, I was just curious. Have you ever been in a procedure and thought to yourself, if we had this, if I had this, like your brain's going 1,000 miles an hour. If I put this with this, if we were able to do this, could we do this?
Well, I mean, for me, necessity is the mother of invention, or I hope I said that right. But yeah, I mean, the beauty about at least the world David and I play in is there's always a better mousetrap. There's always something that we could use. And I think if you look at some of the newer technology, it's yes, some of it's a derivation of something older, but then there's people thinking outside the box, like the spur, and we've talked about PTAB and developing new types of catheters and things. Because I don't know about you, David, but like I will never see everything in my field. Every day I'm always like, oh, that's new. Okay, that's new. That's new. So yeah, it's always evolving.
I'll look at Douglas's question from a different lens. I get a lot of second opinions. I see a lot of folks that others have seen, tinkered, worked on, and the vascular system's a black box. I don't know what I'm going to find until I get in there and look. So what I tell a lot of patients with complicated problems or complicated bypasses or anatomy is today, we're going to get really good pictures. And that's a guarantee. And we'll do it safely and do it well. Mm-hmm. If I can fix you today, I will. But I'm a surgeon. And as John, you said a minute ago, maybe I'll do something with these great toys I've just shown you. Maybe I need a scalpel to do a bypass. I'm not going to do that until I've woken you up and talked to you. So sometimes it takes me more than one attempt to cross a lesion, and that's okay. So very, very commonly, Douglas, my mind, like you just said, is going a million miles a second to figure out what toys do I need? Do I have them here in this lab? Am I better off in an operating room? I think most patients should feel very assured that their vascular professionals have all these tools or have a Rolodex of whoever does have all these tools on their phone to say, hey, maybe you should see somebody else. Maybe this other guy, other girl does a better job than me.
Can I say something real quick? Eric Dane, the actor who just died from ALS, he was on, and I think I'm going to get this right, and if anyone else knows, tell me, but I think he's on, or he did an interview that's on Netflix. I think they're doing a show called Famous Last Words. And I saw a clip of it because several people have been talking about it, and I think if you haven't seen it, you should watch it. I saw a section of it, but he said, because someone asked him, like, well, what advice would you give to somebody right now? And he's like, I wouldn't give any advice to anybody because it's not really my place, but I would recommend that you take a look at your ego, you get rid of your ego and stomp your ego and just be, I'm paraphrasing a little bit, but just be a human. And David, to your point, that like the field that we work in, you've got a lot of folks that can play in that sandbox, surgeons, IR, IC. And, sometimes our egos get in the way and it gets in the way of patient care. And I've said this before and Kym said it. And so, yeah, check your ego at the door, get that patient to whoever can help them. And if it's not me, somebody else and vice versa.
Yeah, completely agree.
Yeah, I think that's so important. And I loved that you say, give up the patient. And instead of just giving in and give up the patient to someone else instead of giving up on the patient. Because different tools, different techniques, different people. I mean, with innovation moving at the speed of light when it comes to PAD, there might be a toy that you really want, but you haven't gotten your hands on it yet because some of these device makers, it takes a lot. It's an intensive resources to roll these things out. And so, for example, there is the DVA or TADV, where they hijack a vein in the calf and they reroute blood flow into the foot. Not everyone has that, not because they're not good, but simply because they're continuing to roll that out. And so before an amputation, there are doctors that have actually called our hotline and said, hey, do you know a doctor that may have one of these types of devices or another option before we go ahead and amputate? But I also like, and I think it's really important for patients to know, a lot of these, and I want to repeat it, it's not just a one and done, because I like when doctors are more methodical and really thinking about, okay, well, I could go into the common femoral artery, which is in the bendy spot. I call it the bendy spot artery. It's your sit artery. In your sit spot. And it's still the gold standard remains endarterectomy. And unless it's pretty easy, I mean, you're not going to really stent there. So you might go in right here in the office-based lab. You might not realize the extensiveness of the disease and go, you know what, we need to do a hybrid procedure on this. Go in there, do an endarterectomy, scrape out the plaque there, and maybe go down with a balloon and wire into the thigh, into the SFA, superficial femoral artery, right?
Sounds very reasonable.
Yep. So I think that that's really important to know. Where's Marcia? Marcia has a question.
Hi.
Hi, Marcia.
Thank you. Towards the almost the last segment, the doctor mentioned having your legs pumped for pad, and I was curious what he was referring to.
Yeah, so got 50 years ago, a lot of early vascular units were bringing people in to, instead of supervised exercise therapy where they were getting on treadmills and walking, they were using compressive pumps to pump the calves. And that was a reasonably common thing to see back in the 80s, perhaps. And it sort of went away. Supervised exercise therapy is the gold standard for ways to get the calf muscles to work, to trigger your body to build new blood vessels around blockages. However, not everybody can get to the point where that's going to work or they can walk far enough to do it. There's been a resurgence of interest in taking some of these machines that used to be hospital only, and some insurance companies will actually cover them for you to have home therapy, where you take this thing out of your closet and you wrap it on your calves while you're watching TV on the couch, and it'll pump your muscles. And that may increase your circulation some small amount to improve you so you can do your daily activities.
There's one in particular called BioTab.
Does it invoke claudication as walking does?
It does not.
Okay.
It does not. Because you're not triggering the muscles yourself, you don't have that lactic acid buildup. That's what you feel. If you're a claudicant and you walk around and you feel like your calves are on fire, it's because your body is converted from using energy as the oxygen as your energy source to something else, because you can't get the blood down there. And the waste product becomes different. And you're feeling lactic acid build up in your muscles because you're cramping and exhausting. So no, if you're not using your muscles, it won't cramp you like that in most cases.
So that's more for somebody who's maybe ischemic or just had a hip replacement or something of that nature?
For somebody who can't do exercise therapy.
Right. Yeah. Thank you.
And I think it's an adjunctive treatment. We use them a lot in our folks with critical limb ischemia. But the trick is making sure that, because the pumps are expensive, and I think you have to, the insurance will cover it. Well, most insurances will cover it if it's appropriately coded.
How is it different than the ones that are used for veins? You can buy a whole bunch of these on, compression pumps on Amazon. And I was told by one vascular surgeon that he's really concerned that for people with heart failure, it might be contraindicated.
Yeah, it's great. It's a really great question, right? So there are a series of companies who have trialed their pumps in PAD and gotten approval for it. I think how you pump your legs, how much pressure you put on them, what your indications are to do it, that's really specific. And it's part of what John and I talked about an hour ago, which is who's on your PAD team, right? This is probably not the best place if you're not otherwise healthy to be shopping on Amazon by yourself. Rely on your doctors, your primary care, your cardiologist, your vascular specialist to talk you through what's best individually for you.
Yeah.
Yep. Heinz has a question. Go ahead, Heinz.
The doctor mentioned that he does endarterectomies, or I think I pronounced that
endarterectomy.
Correct.
Yeah, you're right.
Yeah. So when you remove the plaque, and I asked this of a couple other doctors, do you send that off to be studied?
So we have a tissue bank, and there are certain studies we run on plaque. So sometimes it'll be sent off for a research study if a patient consents to it and we're doing something specific to look at it. Sometimes we send it to the pathologist because sometimes it's not plaque. We find things that are unlikely. But for the most part, for a patient that we know what we're expecting, we are not sending this off to get looked at, to get evaluated or get studied.
Go ahead, Heinz. I know where you're going with this.
What's the unlikely stuff that you find?
He was going to ask.
Great question, right? So we were talking about conduit, or how to get from one part of the body to the other. So Kym and I had a conversation today that somebody didn't want to have their common femoral artery accessed so they could use it another time if they ever had to have a heart procedure. And what I said to Kym is that you can have your leg artery accessed dozens of times in your life, and it'll usually do okay. However, we close the artery when we're done sometimes with a device, and that can dissolve or it can be a permanent implant. Sometimes it doesn't go exactly where we want it to do. We can find it inside the artery. I have found all sorts of things in arteries, from people with broken bones that got cement put into their bones to re-expand them. I found that in blood vessels. I found closure devices in places I wouldn't expect it. I've had people on chemotherapy with Mediports and catheters and long IVs where they've fallen apart and they've embolized different parts of the body. So we find things we don't expect from time to time. And if I don't know what it is, because I'm not smart enough to figure it out, I'm going to ask the guy with the microscope on the first floor to figure it out for me.
We actually had a patient that we sent for a second opinion because the other doctor gave up on her. Well, we found out why. I got a call from the doctor who gave the second opinion. He said, yeah, we found a wire, just a broken off wire in anterior tibial vessel.
It happens. Yeah.
Crazy.
Mm-hmm.
It's amazing that the patient had no idea that there was a wire broken off in their anterior tibial vessel. I mean, it blows my mind that it's not reported, but is what it is.
I actually this is a strange story. I had a patient a couple years ago who showed up in our emergency room, and she's like, I was shaving and I nicked my skin, and then I noticed this like piece of metal coming out of my leg. And I was like, what are you talking about? And we go down there, and sure enough, she's got a piece of metal coming out of her leg. And we kind of figured out, like, okay, how did this happen? And what happened was, as I pieced it together, at another hospital, they put a catheter, which is the tube, in her neck vein for fluids. Or I think she was sick or whatever. Well, they left. We do everything, as David was saying, over a wire. We get a wire into the vein or the artery, and then over that wire we can pass equipment. They left a wire in her, evidently, and it migrated down and somehow got its way into her superficial veins in the leg. And then we pulled it out, honestly. And it was very bizarre. But the most bizarre thing was, I called the hospital. I said, you guys, this patient's not happy, and you might want to figure out how the Swiss cheese there all aligned, all the holes aligned, and this happened. And because I suspect they might be calling a lawyer. But that was probably one of the more strange things I've seen that pulled out of somebody.
Yeah, especially when it just appears. But
Yes.
I thought Heinz was going to get into the microplastic story. You know how many times that story has been shared about microplastic being found in the arteries, and everyone wants to know, do you, as a vascular surgeon, do you ever see plastic, or is it that small in the arteries?
So microplastics are not visible to the naked eye.
Right.
Microplastics are things we consume that have plastic components in them, or we have a plastic implant that degrades over time in our body, keeps those microplastics floating. I don't know what I think of it anymore. John, I'm sure you have strong opinions about this.
It's too late for us, I think. Although I will tell you this, I did get rid of all of our plastic cutting boards, for whatever that's worth. But
my wife came home with bamboo cutting boards yesterday, John.
There you go.
2 of them. Yep. They're on sale at Aldi this week for $6. There's an advertisement to you for Aldi.
I love it.
But
I might go get one.
I don't know if the microplastic, of all the things we can focus on as vascular professionals,
right?
I will tell you that there is a hit list of things that needs to be at the top for us, right? So I think smoking is obviously number one, but there's a series of behaviors and things that people should be aware of for diet, for exercise, for what we put into our bodies. And yes, maybe microplastics are a thing that some people need to focus on, but I think it's probably much more important that we look at the biggest picture of health first before we go down a rabbit hole of microplastics, where some of these carotid studies on microplastics are about to get debunked, it looks like. Not saying they're not real, not saying it's not important, but I focus a lot more of my time right now on marijuana and saying that, marijuana is an acute phase reactant. It seems to lead to coronary and peripheral arterial disease at a much higher rate than the public is aware of, particularly when taken by smoking. I don't know if it's the same as true when ingested, but I think that is a public health crisis that we're not talking about.
No,
as we talk about microplastics.
And I'm actually, it's such a good point, especially on PAD Awareness Day. This is a really big point because Science Direct a couple of years ago came out with a study that showed an increase in the number of 18 to 27-year-olds presenting in emergency rooms with critical limb ischemia on deck for amputation. What do you think the two main factors are? Diabetes and
Vaping?
marijuana.
Oh, yeah.
Yep.
Yeah.
Smoking marijuana and vaping. And people think, I mean, I grew up in that generation where, I didn't know, I wasn't one of those. I have asthma, so I can't smoke anything anyway. So I got very lucky. I don't think I would anyway, but I knew a lot of people, and it was just the cool thing to do. Silicon Valley, during the Silicon Valley big tech boom and bust and reemergence, everyone was smoking pot at every single party. It would spur their creativity and their conversations. But I think we're seeing all of those now starting to present with PAD. And I love when they come to us and they say, I don't have a risk factor. I don't know why I have it. My cholesterol is fine. I've never smoked. Well, you never smoked, regular cigarettes, but you did smoke marijuana. Oh, but that's healing.
Messaging is really hard. So microplastics are going to be an interesting thing that we're going to be able to study because it is going to be something that we can look at inside plaque. So I do think that it'll be something we'll get some answers for.
We have one more question here, Josh. I'm curious of the modality. Is it water pipe or vaping, or does it matter? Anything you smoke, anything you burn.
So, nicotine is sort of an interesting conversation that I think we can have cleanly with some science, right? Nicotine's a heck of a good drug. Nicotine is like caffeine, right? It's a vasoactive drug. It's a stimulant. Stimulants work to make blood vessels smaller transiently. So if you're a coffee drinker out there and you didn't get your morning cup of coffee, you get a splitting headache, it's because your blood vessels are accustomed to having that done.
Yes.
I have plenty of surgical trainees that can't get up at 3 a.m. and put a 20-hour day in without being tired, God forbid. And they take nicotine supplements. So nicotine's an okay supplement as a stimulant in tiny doses. It has risks, but the act of smoking, the act of taking this stuff, aerosolizing it, and whatever else is in it, whether it's stuff in the filter, stuff in the paper, stuff in the tobacco that it was treated in to dry it up, that's the stuff that deposits into lungs. That's what's causing cancers. So I think that it's different. There's microvascular disease patients, people with spasming arteries where they can't be on nicotine or caffeine in any shape or way, not for PAD, but because their arteries will spasm down in cold temperatures under times of stress. We call that Raynaud's phenomenon or Raynaud's disease.
Yep, I have that.
So
me too.
That's a whole different podcast some other day, though.
Yeah, we actually should do a whole podcast on that. We have a lot of patients with it, and they just feel like the doctor brushes them off, but there really isn't anything that they can do officially to cure that, just like, with PAD. But this was a really good show.
Indeed.
Amazing. Red Sock Day for PAD Awareness Day. Really, really important. Make sure you go to youtube.com/the way to my heart. Make sure you like the video, subscribe to our channel. But also on our Global PAD Association Facebook page right now, we have a great PAD Awareness Red Sock Day graphic little video. If you can go to our Facebook page, go ahead and share that. That would be amazing. It would be really helpful to help spread awareness. And we have Douglas actually that has, Douglas, share what you have right now before we close out. He has his socks. Look at this, his PAD awareness socks. And these ones are not compression. These were our original ones that we did a couple years ago. And they have the arteries that are all the way down. But this time around, we put together the compression ones because physicians and clinicians all wanted to have the compression socks, but you can go to peripheralalarterydisease.shop for other great PAD awareness materials. So have a great week, everyone. Thanks everyone for joining us. Thanks, Dr. John. Like the video, subscribe to our channel. Also call our hotline 1-833-PAD-LEGS.